There's a question most men never say out loud, not to their doctor, not to their wife, barely even to themselves in the dark, at 3 a.m. You survived. The doctors called it a miracle. Your family cried in that hospital hallway. And somewhere between the wires and the monitors, you made yourself a quiet promise. I'm going to live differently now. Then you go home. One night, she reaches for your hand. And instead of wanting her closer, your whole body tenses. What if this is the thing that finally stops my heart? Nobody warns you about this part of surviving. Not the scar, not the pills. This. Today, we're going to talk about it plainly, because fear built on silence has ended more marriages than heart disease ever has. And by the end of this video, you'll know exactly what's true, what's myth, and what your heart can actually handle. Before we go any further, I need to say something clearly, because everything after this depends on you trusting it. This video is for education only. It does not replace a conversation with your own cardiologist who knows the exact condition of your own heart. Every recovery is different. Use what you hear today as the beginning of a conversation with your doctor, never as the final word. Now let's name the real enemy in this story. It isn't your heart. It's fear dressed up as caution and misinformation dressed up as common sense. Those two things together have taken more from couples after a heart attack than the heart attack itself ever did. The American Heart Association published a formal scientific statement years ago addressing exactly this, the resumption of sexual activity after a cardiac event, because doctors kept noticing the same pattern in exam rooms across the country. Patients recovering well physically, but avoiding intimacy for months, sometimes years, out of fear alone. That statement made something clear that still isn't common knowledge. For the majority of people who've had an uncomplicated heart attack, resuming sexual activity carries a risk so low it's measured in fractions of a percent. Not zero, but low enough that avoiding it isn't protecting your heart, it's just protecting your fear. Here's the comparison cardiologists use, and I want you to really sit with it. Sexual activity, in terms of physical exertion, is roughly equivalent to climbing 2 flights of stairs at a steady pace, or a brisk 10-minute walk. That's the actual physiological demand we're talking about. If you can do that without chest pain, without crushing fatigue, without your breath running out, your heart, in most cases, can very likely handle intimacy too. The exertion is real, but it's modest. It is not the mountain your fear has built it into. Let me tell you about a man I'll call Walter, not his real name, details changed, but a composite of a story I've heard, in different versions, more times than I can count. Walter was 63, had his heart attack on a Tuesday morning while shoveling snow. 2 weeks later, home from the hospital, his wife of 31 years reached for him in bed, the way she always had. Walter pulled away, not because he didn't want her, because he was terrified his heart would stop mid-embrace, and that would be the last thing he ever did to her, kill himself in her arms. That fear sat between them for 4 months. 4 months of sleeping back to back. 4 months of her wondering if he'd stopped loving her, and him too, ashamed to explain that it was the opposite. He loved her too much to risk it. When he finally said it out loud, at his cardiac rehab follow-up, his doctor asked him one simple question. Walter, can you climb 2 flights of stairs without stopping? He could. He did it 3 times a week at rehab. The doctor looked at him and said, then your heart already proved it can do this. I share that story because I suspect some of you watching are living exactly inside it right now, just with different names, different houses, different kitchens, where the silence has settled in. If you felt that same silence in your own home, hit the like button below. That simple click helps YouTube share this message with other couples who really need to hear it right now. Now let's talk about actual timelines, because vague reassurance helps no one. Precision does. For most patients recovering from an uncomplicated heart attack, cardiologists generally clear patients for sexual activity somewhere between 1 and 3 weeks after the event, provided a follow-up evaluation shows no ongoing chest pain, no unstable rhythm, and reasonable exercise tolerance. For those who've had bypass surgery, the timeline extends, usually 6 to 8 weeks, not primarily because of the heart itself, but because the breastbone needs time to heal. and physical strain on that incision matters more in those early weeks than cardiac strain does. And for anyone with more complex conditions, unstable angina, significant heart failure, certain arrhythmias, there is no universal number. That conversation belongs entirely between you and your cardiologist. And I'd go further. If that conversation lasted less than 2 minutes in a hallway, you're allowed to ask for it again, properly, in a scheduled appointment. This is a legitimate, expected part of cardiac rehabilitation, not an inappropriate request, not something to whisper about. Because here's what the research keeps confirming from multiple angles in study after study. Sexual activity isn't just something your heart can tolerate. For most survivors, it's something connected to genuinely better outcomes, lower rates of depression, better blood pressure regulation over time, stronger adherence to rehabilitation programs, because people who feel like themselves again tend to take better care of the body that's carrying them. Intimacy, in other words, isn't the opposite of heart health. In most cases, it's part of it, and yet the silence persists. Why? Because fear doesn't wait for permission, and it definitely doesn't consult a study before it moves into the bedroom. That fear, though, isn't the only obstacle we need to talk about today. There's a small blue pill that half my patients ask about in whispers, and the other half are too afraid to ask about at all. And what that pill can and cannot be mixed with is a matter of life and death that almost nobody explains clearly enough. Let's talk about that pill. The one advertised during football games with couples walking hand in hand on some impossibly perfect beach, but never once, not for a single second, mentioning the words heart attack in the same breath. Medications like sildenafil, tadalafil, and vardenafil, the ones you know by their brand names, work by relaxing blood vessels to improve blood flow. For many men recovering from a cardiac event, they can genuinely help restore function that fear, medication side effects, or reduced circulation have taken away. But here is the one piece of information in this entire video that is not optional, that is not a matter of opinion, that is quite literally a matter of life and death. These medications must never, under any circumstance, be combined with nitrate-based medications. If you take nitroglycerin or any nitrate for angina, mixing it with an erectile dysfunction drug can cause a catastrophic, sudden drop in blood pressure. This is not a mild interaction. This is the kind of combination that sends people to the emergency room. Sometimes it's the kind that doesn't give you time to call for help at all. So before anyone reaches for that pill, a conversation with a cardiologist isn't a suggestion. It's a safeguard, plain and simple. Your doctor needs your complete list of medications, every single one, including the ones you think are too minor to mention, before this becomes part of your life again. I've watched men sit across from me and leave this detail out of the conversation, purely out of embarrassment. I understand the impulse. Nobody wants to discuss this openly, not even with someone whose entire job is to listen without judgment. But I need you to hear this clearly. Embarrassment has never once saved a life. Honesty with your doctor has saved thousands. Now I want to pause here, because there's a silence inside this topic that runs even deeper, and it's one I think about often. We talk about male hearts, male bodies, male fear, as if women simply aren't part of this conversation at all. And that silence has its own cost, a cost that's rarely measured because almost nobody asks the question in the first place. Women who survive heart attacks live inside a particular kind of invisibility. Studies have repeatedly shown their cardiac symptoms are recognized later. Their recovery is discussed less thoroughly, and almost no one, not their doctors, not their families, sometimes not even their own partners, thinks to ask them about their intimate lives afterward. There's an unspoken assumption that this simply isn't a woman's concern once she's safely recovering. That assumption is not just outdated, it's harmful. I think of a woman I'll call Carol. Again, a composite. Details changed, but a story that echoes across exam rooms more often than people realize. Carol had a heart attack at 58. Her husband, Frank, became almost obsessively protective afterward. Wouldn't let her lift a grocery bag, wouldn't let her climb a ladder to change a light bulb, and quietly, without ever discussing it, stopped reaching for her in bed. He thought he was protecting her. What Carol felt was that she'd become fragile in his eyes, not his wife anymore, but a patient he was managing. It took her nearly a year to say, out loud, In a follow-up appointment with her cardiologist present, "I miss being touched like a woman, not like glass." Her doctor's answer was simple. Her heart had recovered well enough for intimacy months earlier. Nobody had ever told Frank that. Nobody had ever asked. Women's bodies carry additional physical layers worth naming honestly. Reduced blood flow after a cardiac event can affect arousal and natural lubrication. Certain blood pressure medications can dull physical sensation. And there's an emotional weight that tends to sit heavier on women, many of whom have spent a lifetime as the caretaker in the family, suddenly finding themselves needing to be cared for, and not quite knowing how to accept that shift. If you are a woman watching this, or if you love one who has lived through this, hear me clearly. Your questions about intimacy are not vain. They are not secondary to your recovery. They are part of it. There's one more piece of this puzzle that explains, I believe, more of what happens in bedrooms across this country than any medication ever could. Depression. Research following heart attack survivors has found that a significant portion, some studies point to roughly 1 in 5, experience depression in the months following their event. And depression doesn't sit quietly in some corner of the mind, contained and polite. It reaches directly into desire. It dims it. It turns closeness into something that feels like effort instead of comfort, like a task instead of a gift. This is precisely why, when someone tells their doctor, "I've lost all interest since my heart attack," the answer isn't always physical. Sometimes the heart has healed perfectly well on paper, and it's the mind that's still lying in that hospital bed, wired to machines that stopped beeping months ago. The National Institute on Aging, along with multiple studies published on sexuality and well-being in older adults, consistently points to the same conclusion. Intimacy in later life isn't a luxury, and it isn't frivolous. It correlates with lower rates of depression, better markers of cardiovascular health over time, and a stronger sense of connection to one's own life. Desire at any age isn't separate from health. It's woven into it. Which brings us back again to the real enemy in this story, not the damaged heart tissue, not the medication list, not even the anatomy of fear itself. It's silence. It's the misinformation that convinces good, loving people to protect each other into isolation. And there's still a number I haven't given you yet. A single statistic that once you hear it, might change the way you think about waiting entirely. Here is that number. Less than 1%. That is the estimated risk, according to cardiology research spanning decades, of a heart attack occurring during or immediately after sexual activity in someone with a history of cardiac disease. Less than 1%. Now compare that to another number from those same studies. Nearly 90% of couples report that fear alone, not medical advice, not physical inability, just fear, kept them apart for months, sometimes years, following a cardiac event. Read those two numbers side by side. The disease already took enough from you. It didn't need to take this too. Fear did that part entirely on its own. There's research that cardiologists cite often, tracking thousands of heart attack survivors over time, which found that regular physical activity, including sexual activity, correlated with better cardiovascular outcomes, not worse ones. The heart, like any muscle in the body, doesn't grow stronger by being protected into uselessness. It grows stronger through careful, guided use. That is, quite literally, the entire philosophy behind cardiac rehabilitation. Controlled exertion, monitored progress, slowly teaching a frightened heart that it can trust itself again. But precision matters here, because false comfort helps no one. And I have no interest in giving you a version of the truth that's been softened past usefulness. That less than 1% risk isn't spread evenly across every situation. Research has shown the risk rises specifically in circumstances involving unfamiliar partners, unfamiliar surroundings, heavy alcohol consumption beforehand, or a large meal eaten right before activity. In other words, it was never intimacy itself that carried the danger. It was intimacy combined with a body caught off guard, working against itself on multiple fronts at once, which tells us something almost tender if you sit with it long enough. The safest place for a healing heart to relearn closeness is exactly where you'd expect it to be, with someone familiar, someone trusted, in a setting without rush, without alcohol clouding the moment, without the body being asked to do too much at once. In this very specific, very literal sense, a long marriage bed is one of the statistically safest places in the world. I find it almost humbling that it took formal studies to confirm what grandmothers seem to understand instinctively for generations, that steadiness, familiarity, and unhurried tenderness were never enemies of health. They were quietly protective of it the entire time. Timing within the day matters too, and this detail surprises almost everyone I share it with. Cardiologists frequently note that mornings, after a full night of rest, tend to place noticeably less strain on the heart than late evenings, after a long day of accumulated stress, a heavy dinner, or a glass of wine. A rested heart simply carries less burden than one that's already spent all day carrying everything else. And exercise, more broadly, deserves real credit here, because structured cardiac rehabilitation remains one of the most underused tools in a survivor's recovery. Patients who complete supervised programs involving walking, light resistance training, and gradually increased exertion don't just show improvement in test results and charts. They report consistently, across study after study, a return of confidence in their own bodies. And that confidence doesn't stay contained to a treadmill in some clinic. It walks with them into every room of their life, including the one where the lights go out at night. Now, let's talk about something practical, something your cardiologist may have mentioned once, quickly, and then never again. Medication matters here, and not just the erectile dysfunction pills we already discussed. Beta blockers, one of the most commonly prescribed medications after a heart attack, are excellent at protecting your heart. They slow it down, reduce its workload, keep it from racing under stress. But that same mechanism can sometimes reduce sexual desire or function as a side effect. If you've noticed a change since starting one of these medications, that's not something to suffer through silently, and it's certainly not something to simply accept as part of getting older. In many cases, doctors can adjust dosage, timing, or switch to an alternative medication that protects your heart just as well without that particular trade-off. But that conversation only happens if you start it. There are also practical adjustments that cardiac rehabilitation specialists often recommend quietly in follow-up visits, adjustments that rarely make it into public conversation but make a real difference. Avoiding sudden temperature extremes matters more than people realize. A very hot shower or bath right before intimacy causes blood vessels to dilate suddenly, which adds strain precisely when the heart is already working harder. Choosing positions that require less isometric exertion, meaning less sustained muscle tension, less bearing of weight on the arms for extended periods, can meaningfully reduce cardiac workload for those in early recovery. None of this needs to feel clinical or unromantic. It's simply information that lets you move forward with confidence instead of guesswork. And there are legitimate warning signs worth knowing, not to create fear, but to replace vague anxiety with clear, actionable knowledge. Chest pain, unusual shortness of breath that doesn't resolve quickly, irregular heartbeat, or dizziness during or after sexual activity are signs to stop and contact your doctor. The same signs, essentially, that would tell you to stop any moderate physical activity. Knowing this distinction is often what separates a survivor who lives cautiously but freely from one who lives in constant, unnecessary alarm over every quickened heartbeat. I think of a man I'll call Robert, 69, 3 months out from a moderate heart attack, who told his cardiologist he'd simply given up on that part of life. When his doctor asked why, Robert admitted he'd tried once, felt his heart pounding harder than expected, panicked, and never tried again. His doctor asked a simple follow-up question. Was it pounding harder than it does on your daily walk? Robert paused, then admitted he'd never actually compared the two. He'd just assumed pounding meant danger. That single reframe, comparing sensation to something he already did safely every day, changed how Robert understood his own body. He wasn't broken. He'd simply never been taught what normal exertion was supposed to feel like versus what a true warning sign felt like. This is, I think, the quiet tragedy sitting underneath so much of this topic. It isn't that people are given false information nearly as often as they're given no information at all. Silence gets mistaken for caution. Assumption gets mistaken for medical fact. And in that vacuum, fear writes its own rules, rules far stricter than anything a cardiologist would actually prescribe. Knowledge, in this specific corner of recovery, isn't just comforting. It's protective in the most literal sense. Because a well-informed patient makes better decisions than a frightened one, every single time. I want to say something now that has less to do with cardiology, and more to do with what I've witnessed over years in this work. The body heals on its own schedule. But trust between two people, and trust within yourself, heals on an entirely different one. Sometimes slower than the scar tissue. Sometimes, strangely, faster than anyone expects. There's no blood panel for that kind of healing. No stress test. No machine that prints out a number for it. That particular kind of recovery happens in quiet places, in a hand held a little longer than necessary, in someone finally saying, "I'm scared too," out loud, instead of carrying it alone through another silent night. If there's one thing I hope stays with you longer than any statistic in this video, it's this. Your heart attack was an event. It happened. It changed things. But it was never meant to be a life sentence handed down against closeness, against touch, against the parts of being human that make surviving feel like it was worth fighting for in the first place. And there's still one layer of this story we haven't touched. Something about the people standing beside the hospital bed instead of lying in it. The partners. Because they carry a fear of their own. One we almost never talk about at all. There's a fear that almost never gets talked about because it doesn't belong to the patient. It belongs to the one standing beside the bed. The husband, the wife, the partner of 30, 40 years who watched the ambulance lights, who sat in that hallway not knowing if there'd be a tomorrow to plan for, and who now lies awake at night with a fear that sounds almost selfish when said out loud. What if I'm the one who kills them? I've heard versions of this from so many partners over the years that I've stopped being surprised by it, though it never stops moving me. A wife whispering that she's afraid to reach for her husband, because what if her touch, her desire, becomes the thing that finally stops his heart? A husband who stopped initiating anything at all after his wife's bypass surgery, not because he stopped loving her, but because some part of him decided that being her nurse was safer than being her lover. As if those two roles couldn't possibly live in the same marriage at the same time. Let me tell you about a woman I'll call Diane. 61 years old, married 38 years to a man named Harold, who had a serious heart attack on a Sunday afternoon while mowing the lawn. Diane did everything right in the months that followed. She learned every medication by name. She cooked every meal according to the cardiac diet his doctor recommended. She drove him to every single rehab appointment, but she also, quietly, without ever announcing it, stopped being his wife in the bedroom and became, entirely, his caretaker. Harold noticed. He just didn't know how to say it, and Diane didn't know how to stop it, because in her mind, stopping felt like risking his life, and starting again felt like something she wasn't allowed to want anymore. It took 8 months, and a particularly honest conversation during a rehab session for Harold to finally say what he'd been carrying. I don't want a nurse. I had a nurse in the hospital. I want my wife back. Diane cried in that appointment. Not from sadness, she told me later, but from relief. Relief that someone had finally given her permission to stop being afraid of her own husband's body. This is the layer almost nobody prepares you for. Cardiac recovery focuses, understandably, on the patient, the scans, the medications, the rehabilitation schedule. But there are 2 hearts in every marriage affected by a heart attack, and only one of them shows up on the EKG. The partner's fear is real. It's valid and left unspoken. It can do just as much damage to intimacy as the heart attack itself. If you're the partner watching this right now, not the survivor, but the one who held their hand in that hospital room, I want you to hear something directly. Your fear doesn't make you weak or overprotective or unloving. It makes you human. But that fear was never meant to be carried alone, and it was never meant to be the thing that quietly ends your physical relationship without either of you ever choosing that outcome on purpose. Now, if you've stayed with me this far into the video, I want to ask you something, and I want you to actually consider it before scrolling past it. If any part of this, Walter's story, Carol's story, Diane's story, felt familiar to you, even a little, even in some version you haven't told anyone yet, I'd like to invite you to subscribe to this channel and join us here every week. Because conversations like this one, about what actually matters after 50, without the shame, without the silence, are exactly what we do here. And I want to ask you directly, because I read every single comment. Which fear has been harder for you to face? The fear of your own body, or the fear of finally saying it out loud to the person you love? Tell me in the comments. I mean that. Now back to what matters most, because there's one more piece of this conversation that ties everything we've discussed together, and it has nothing to do with medicine at all. What research consistently shows across studies on aging couples, on cardiac recovery, on long-term marital satisfaction is this. The couples who recover best, not just physically, but as partners, as people who still choose each other every day, are the ones who talk about the fear instead of managing it in silence. Not the couples who avoid the topic to protect each other. Not the couples who pretend nothing changed. The ones who sit down, sometimes awkwardly, sometimes with tears, and say the hard sentence out loud. I'm scared too. That sentence, more than any medication, more than any cardiac rehab program, more than any statistic I've shared with you today, is often the actual turning point. Because fear that's spoken has a strange property. It starts losing its grip the moment it's no longer a secret. Fear that stays silent, on the other hand, tends to grow. It fills whatever space you give it, a bedroom, a marriage, sometimes an entire decade of a life that could have looked completely different. I think about Harold and Diane sometimes, years later in my memory, and what stays with me isn't the heart attack at all. It's the sentence that saved their marriage. Not a medical breakthrough, just a man finally admitting he missed his wife, and a wife finally admitting she'd been terrified this whole time too. That's the part of cardiac recovery no chart can measure and no medication can provide. And it's the part, I'd argue, that matters most. So let's go back to where we started, 3 a.m, a hand reaching across the bed, a heart that survived one storm, wondering if it can survive being loved. Here is what I hope you carry out of this video, more than any statistic, more than any name I borrowed to tell you a truth. Your heart already proved something extraordinary. It kept beating when it mattered most. It doesn't need you to protect it from tenderness now. It needs you to trust it a little, the same way you trusted it to survive in the first place. Walter climbed his 2 flights of stairs. Carol asked to be touched like a woman again. Harold finally said the sentence he'd been swallowing for months. None of them were braver than you. They just stopped carrying the silence alone. Somewhere tonight, someone is lying in the dark, afraid of their own body, afraid of disappointing someone they love, afraid of a number on a heart monitor that already told them the truth weeks ago. Maybe that someone is you. Maybe it's someone sitting right next to you on this couch. If this video gave you even one honest sentence to say tonight, say it. If you're still here, subscribe to this channel and share this with 5 people who need to hear it. A friend, a sibling, someone recovering, someone scared, someone who stayed silent for far too long. Tell me the truth in the comments, not the polite version. And tell me what we should talk about next, because this conversation about life after 50 is far from finished. The heart that survived deserves more than fear. It deserves to be lived in again.